Hi, welcome to another Fix Your Gut live stream. My name is Jason Hooper, and we're here again with John Brisson.
Hey everybody, hope you're having a good night tonight.
Today, we're going to be talking about healthcare in America, and little maybe a gloomier topic than we're used to. Um, and we're going to talk about some of the problems that people are facing with healthcare and go into some of the history over healthcare. John's grandfather was just in the hospital, so he's been dealing with this pretty closely here in the last couple days.
Oh yeah, he broke his femur, and I guess one thing first, just a disclaimer because I'm going to tell a lot of personal stories during this, and I'm probably not going to be too nice to allopathic medicine right now because I'm dealing with it. But there are a lot of good doctors, nurses, and people working in the healthcare field right now who really honestly believe that they are helping people, and they are helping people too. And this podcast really is not directed towards those people who try their best to improve people's quality of life and really give the job to their fullest, even if some of the methods they use we might not agree with. Just to say that this podcast isn't about them. There are a lot of people who are really truly doing wondrous things, even when it comes to conventional medicine.
Yeah, let's just lay down some ground rules right now, just so we can try to adhere to them as much as possible. So one of the things that I'd like to do is not get politically charged. I don't think that's going to do us any good to put on our political party jerseys and be like Team Republican, Team Democrat, Obama. That it's kind of counterintuitive because I don't think political party necessarily has very much to do with healthcare, even though we might be diving into some political issues every once in a while. But we're just going to try to look at this stuff as objectively as possible, and not and try not to be influenced by political bias, if that makes sense. Next thing I want to make clear is that we don't want to come down on physicians or any companies in general. Like most people they're trying not to be scammers. They're trying to do their best. And especially the doctors out there. And kind of the reason why I want to do this show is because when I've been interviewing physicians and stuff, and I always ask them like, well, why are you going out of the medical industry? It's like I had this surgeon, and it's like, that's a pretty good gig, right? You're making quite a bit of money. Why would you get out of that and go into a supplement company or something? And all of them are just frustrated. The doctors are frustrated, the patients are frustrated, everybody's frustrated. And we're going to try to dive into some of these issues a little deeper and try to figure out what's going on here. So I guess we can start way back in the Civil War era, which is kind of when private insurance started to be sold. And healthcare wasn't really good at the time of the Civil War. It was pretty ineffective. I mean, they had some basic first aid stuff, but they were still like doing some
Amputating pretty much. If you got a massive infection, just go ahead and cut it off. And also, our standards of disease, knowing about what causes infections and so forth and so on, wasn't too great back then. It started to develop, but a lot of infections were still associated with filth compared to actual microbes. So it was pretty rudimentary back then.
Yeah, so licensure back then for a physician was pretty basic. I mean, a lot of people just learn things on the job, and it was pretty unregulated. Medical insurance at the time, it was the first time in American history where they were starting to sell medical personal, I guess, private medical insurance policies, and it was basically to cover travel because a lot of people were traveling on railroads and steamboats, and if they'd get injured on the way, they'd get coverage. The coverage wasn't designed necessarily to take care of their medical expenses, which were negligible at the time. It was more like workman's comp, and it was going to take care of their bills. So while there was no health insurance ineffective, it was very inexpensive. And so it wasn't until it was 1929, and there was a group of teachers in the Dallas-Fort Worth area, and they decided that they wanted to prepay for medical insurance just to help their teachers budget a little bit better for healthcare. And so they prepaid one of these hospitals, and just say, okay, well, here's some money, and if our teachers come in, they're covered. And so that's sort of like the birth of the idea of private health insurance in the United States. And then we ended up getting, Blue Cross Blue Shield, some of these nonprofit companies. And then today, I think we have an estimated 1,200 private health insurance companies that are out there. So it's gotten a lot bigger over the years, and the cost has gone up over the years as well, just to kind of coincide with that. If you look at the data for childbirth and mortality rates and all this stuff, it's all getting better. So it's hard to point the finger and say, well, our system's not doing well because all the numbers look good. But I don't necessarily think that they correspond. Do you, John? I mean, our technology is getting better too. Our science is getting better. So it may not be the system that's improving. Those two factors may be independent of one another. They may not be corollary.
Correct. I mean, the healthcare system, as far as the United States is concerned, talk about infant mortality rate, for example, compared to other first world countries, the United States is not that great. If I remember correctly, I actually can't remember exactly where we are. I think it's somewhere in the 40s, if I remember correctly. It's relatively low for a first world country. It actually might even be lower than that. I can't remember offhand, but
from what I remember, I think it's something like 20. This is just an estimate, like 25 deaths out of every 1,000 live births.
It's not good. It's not good for a first world country at all, and a lot of that has to do with the fact is our healthcare system is just so bogged down in both, bureaucracy and lobbyists, as well as healthcare companies, gouging hospitals for, let's say, a bag of saline that causes maybe at most $1 to produce, and that's even being generous. When you go to the hospital or be hospitalized, the hospital ends up charging the insurance company not $100 per bag of saline, which is just ridiculous. In some cases, I've seen anywhere as much as $1,000 for a bag of saline. The whole healthcare system is just horribly screwed up here in the United States. We do pretty well with our private doctors as far as if you have the money, you can get some of the best healthcare available throughout the world. But other than that, if you rely on health insurance or, public hospitals, for example, your standard of care might not be the best in the world.
So in the Harry Truman administration, he was, as far as I know, he's the first American president to talk about doing a federal insurance program and trying to get universal coverage. And of course that didn't happen, but LBJ after him got the ball rolling with Medicare, Medicaid to try to ensure the elderly and the disadvantaged. And then so we had some social programs going on, getting more people insured. Now today with the American Healthcare Act, we have, I guess everybody has the option now to go and purchase health insurance. But speaking to I guess some of the, the insurance I don't think sets the billing on.
They negotiate with hospitals, to my knowledge.
Yeah.
They say this is how much, and they're always going to try to pay. Okay, hospitals are always going to try as much money as they can get for saline, for example, from the insurance companies. It's pretty much a scam. So they'll say, oh, we want $100 per bag of saline. So the insurance says no. Instead, we'll give you 20. And the hospital will say no, we'll give you 40. No, back and forth until they set a number, but it's still way more than how much it should be. I know for Medicare, for example, which I'm going through with my grandpa right now, he broke his femur. They're only giving him 4 days in the hospital. 4 days for a broken femur, which is pretty major. And where are they going to ship to him after that? A rehab facility, which of course isn't the best in the world. And it's sad, I mean, my grandpa's only been to the hospital a handful of times in his life, has been relatively healthy, took care of himself, never smoked, never drank. And it's sad how, okay, here's 4 days, to recover, and then we're going to stick you in a place. And it's just, healthcare just messed up in this country.
Yeah, it's the similar thing happened to me when I had surgery a while back, and I got the bill afterwards, and I had to fight with my insurance company to pay it, even though I had it pre-authorized. And I looked at the bill, and I looked at every single thing that they were billing me for, and they used Neosporin on my incisions, and they charged me $800 an ounce for Neosporin. There was a CVS right across the street where you could get it for like $2 an ounce.
And it's just sad because hospitals, like, let's say hospitals claim, well, the reason why we charge insurance companies this much is because we have to make up the cost through how much the government pays us as a subsidy, as well as how much people who don't pay their bills, for example, we have to coop our losses from that. Well, that's all fine and dandy, but most of the time when someone doesn't pay their bill through a hospital, all it is a tax write-off. Hospital doesn't lose any money on that. So to coop their costs, they're going to gouge their prices. And of course, insurance companies have to pay a certain amount of that. And depending on your deductible, whatever's left from that amount, you have to pay it. It's not a good system.
Yeah, I mean, I would say that I would disagree with you a little on a couple of those items. I mean, first of all, let's just use my example. It's just one example out of everything, but an $800 an ounce of Neosporin, just that's a 400 time markup. So 400 people would have to have the same operation and use the same amount of Neosporin without paying for it to cover costs. So I don't really think that that's gonna, that's a large markup.
I'm not saying they are, but they're just using it to highball the insurance companies so that they can try to get as much money as they possibly can out of them.
Yeah, and what's happening is, like, the insurance companies don't care because they just raise their rates, and then
they don't care,
and then we end up paying for it anyway. But another thing is, with the whole tax write-off thing, a patient comes into the hospital and they can write off a percentage, they can write off a little bit of what goes on, but that only affects their income budget. So they still have to pay for all the services. They just don't get taxed on treating indigent patients, people who can't pay. So it's not a free ride when somebody comes in and can't pay. And I don't suggest that we go to a system where, if people are broke and they go into a hospital and we're like, oh, sorry, you're going to die. We should do our best to treat them. But if we could bring the total healthcare down, everybody could pay their bills pretty easily. And that's historically what everyone has done. And if you go back to, the 20th century, mid 20th century, paying your medical bills was no problem. Not very many people had medical insurance, and it was no big deal. Medical costs were pretty low.
Yeah, they were.
Standard of care was pretty high. Our technology wasn't as good as it is now, but I mean, a lot of doctors didn't even have offices. They'd come to visit your house. Now it's completely backwards, where you go in and you're standing in line, and finally you go talk to a nurse, you get weighed in, and then a doctor comes in, looks at your chart, talks to you for 5 minutes.
A PA would come in first before the doctor would ever see you, because you don't get that standard of care anymore. Just like if you go to a doctor's office, you always see the PA before you see the physician, if you see the physician at all, because the physician just doesn't have enough time.
Right, and so what they've done is they've reduced that time window, and they have cut out sort of the middleman. So the doctor really is only there to verify what RN or the PA has written down, and then pull out the prescription pad. In fact, well, even a lot of nurse practitioners now can prescribe medications. So they're basically a lot of these facilities are just prescription writing machines. And that's just all they're there for. But going back to early healthcare, where a doctor would come out to your house, and that would take a lot of time just for travel, and then they'd stay with you. You'd get a lot more attention from the physician, and they'd really look at you and they'd really try to figure out what was going on. And then at the end, the bill would be affordable and people could pay it and it was no big deal. So now we're getting less attention from physicians and we're paying a whole lot more. A statistic that I recently read was that 85% of our medical expenses are going just to administration costs. So we're talking about almost $900 billion a year spent in America just on paper, like filing paper, administrative fees, and hospitals. So that's a lot. Physicians paying doctors directly only represents 10% of the total expenditure. So we're talking about just under a billion, or I guess it'd be it'd be like I don't know, like 9 billion or something. So we would so it's not like, oh, we're just paying doctors so much money, and I think that if anything, doctors are underpaid.
They are.
And I don't think that they, a lot of doctors, if you ask them, hey, you like this revolving door situation where you're in and out in 5 minutes? No, they don't like it.
But they have to do it to get paid. They have no other choice through through Medicare and everything else. They can't spend only a certain amount of time per patient, to make a living.
Yeah, another thing that happened through the 1950s and 60s was that the American Medical Association started to get really strong, and I think by 1960, I think 75% of doctors were registered with the AMA, and they started putting in licensing standards, and they started to really codify what it means to be a physician, what you need to do to be a physician, the education, the background. And I think a lot of that is good. I think we want to have educated physicians and qualified physicians. But what they also did was they put a monopoly on becoming a doctor.
That's
right?
the problem.
So you have to go through this, and they can control the number of doctors that are accepted, the number of doctors that are in the field. And if there's not enough doctors there and there's too many patients, then they create a problem. And a lot of this was response to World War II, where nursing was at an all-time high. We had a lot of nursing volunteers, even people that were traveling abroad, or nursing and medics and all this stuff. And they came back and they wanted to work in the medical industry. So the medical field just boomed after World War II. So you have, the late 40s, 50s, 60s, rise in people, in occupation, and in workforce. And so we kind of compensated for it with bureaucracy. So another interesting statistic that I read, from 2010 it was from 2001 to 2010, the number of doctors registered with the AMA dropped from almost 300,000 to 200,000 in a decade. So that's like a third of doctors are just getting out of that racket.
Did they just get fed up with it all? With it's like my grandpa was a pharmacist. He used to be able to give patients a good amount of care before all the insurance paperwork they had to fill out, starting with the mid to late 90s. And now when you go see your pharmacist, majority of the time, all they're doing is insurance stuff, where your pharmacist assistant, they're who are actually filling the medications and so forth and so on. So it has to be the same thing where, people are just getting fed up with all the bureaucracy and all the red tape that's involved.
Yeah.
All the hurdles they have to jump through.
And that's interesting too, because like blaming the doctors for healthcare would be like blaming the pharmacists for the pharmaceutical companies and the FDA. I mean, you go to the pharmacy and the doctor, behind the Walmart counter or the CVS counter, Walgreens, whatever store you go to. And I hope I don't get in trouble with YouTube or whatever for naming franchises, but you're not going to go and start yelling at them for the pharmaceutical blunders that are going on. And John, talk about that Wellbutrin thing.
Oh God, okay. A lot of people have known for years that Wellbutrin, the generic for it, just was not doing anything. Jason and I could debate all day about whether SSRIs are effective and so forth and so on. But, there are some instances for bipolar or, major depressive disorders where they can show some benefit. Anyway, and a lot of people were taking the generic for Wellbutrin. It just was not doing anything at all for them. They weren't feeling anything. It was being reported in a lot of your alternative press, even your mainstream alternative medicine press, like People's Pharmacy, for example. People are writing in saying, "Hey, I'm taking, the generic for Wellbutrin, and I'm not feeling anything. I'm not feeling anything at all." Well, it turns out that, okay, my grandpa would always tell me that generics have to have the same standardization of medicine. So let's say that you have 10% of an active drug that's in the whole formulation. Then if you get a generic, it has to still be 10%. But the inactive ingredients can differ. The fillers can differ between the generic and the non-generic medication. But your standard active medication has to be the same standardization. Okay. So apparently with Wellbutrin and its generic, for example, the generic just wasn't anything at all. It was just a placebo, pretty much. So the FDA was started to become aware of it, let's say about the mid 2000s. People have been complaining about it for a lot longer, mid to late 2000s. So they go to the company that produces Wellbutrin itself, Teva, and ask them, hey, instead of the FDA saying, hey, we're going to do a study, we're going to find out, we're going to go to your drug facility, we're going to find out, to make sure that this, the generic that you're using is the exact same. We're going to test it, quality control, so forth and so on. The FDA was like, no, we're not going to do it. Instead, you do it. So Jason, what for the pharmaceutical company, why would they not drag their heels? Why would they not take 5 years? Why would they complain that they can't get enough people to form a trial when, there's, millions of people were taking Wellbutrin. It's one of the most prescribed antidepressants of all time in the 2000s. So it boggles my mind of how, the FDA, instead of testing the drug itself, gave Teva and said, hey, you do it. And then after they didn't do it, for 5 years, okay, then the FDA starts investigating.
Yeah, if you want my honest opinion, I think all of the SSRI stuff is a racket anyway. And I don't think they're addressing the root of the problem. I don't even think biochemically they're addressing the root of the problem or psychologically. One is they've been able to devise something that's very hard to quantify, which is mental health. And it's a long time to see results. And so, it's just the perfect racket. You're like, okay, well, we're going to give the patient this medication and it's going to take them this long to respond to it, which is it's going to take another visit just for them to get a benchmark. And then we're going to dial up the dose or dial down the dose, and we're going to go on and on and on. And that's basically how they do it. So
which is what happened in this case. The FDA, when they originally approved the generic form of Wellbutrin, they only studied the 150 milligram dose, which documents later came out. And what was hilarious is they just exfoliated the data, exfoliated where they were like, okay, the 150 milligram works, so I'm pretty sure the 300 milligram should work too. And the 300 milligram was what did not work at all. It was, pretty much a placebo. There was not any active ingredient in it at all. So, it's sad how the FDA, just so much negligence, Jason.
Yeah, they basically created a placebo group. They started testing people as a placebo group with no active medication, and they charged people for it. And they just kind of ran an experiment. So if any of those people did get better, from taking the generic Wellbutrin, or what was the new version that had the 300?
Well, they had 150 milligram and a 300 milligram. Apparently, they claimed that the 150 milligram somewhat worked, the generic, even though they had some issues. But the 300 milligram did not work at all. It just would. It would. I don't know if it was because there was not any active ingredient of Wellbutrin that was in there. The Beriperion or what. It's funny how the FDA just, when they approved the generic, they blanketly approved both milligrams without even testing the 300. And then they pretty much sold this generic placebo 300 milligrams for a good 8 to 9 years before it was taken off the market.
Yeah. And that's just a lot of I guess, mess ups that have been coming through. Just kind of the bottom line is that it's not the pharmacist. I guess what we were trying to get at was this isn't the pharmacist's fault. The pharmacist is there to answer questions that people might have. They're also there to be accountable for the other workers, to make sure that things are running right and that people are getting their right meds and the right number of meds and that there's no fraud going off. But, it's a very, when you talk about the pharmaceutical companies and you talk about healthcare from that end, it's a very protective industry. In fact, 2 of our videos that we posted to YouTube, the advertising got pulled before we could even get enough viewership to earn an entire penny. We were trying to earn our first cent on YouTube, and we were almost there. I mean, we were at, I think, the 5,000 minute mark. People watch 5,000 minutes of this, which is kind of funny to me because we're kind of still in the test phase where we're just messing around. But they pulled our advertising because we mentioned some prescription drugs, and then they tried to take down. I had to appeal. It's still up right now, but they're trying to take down Fix Your Gut live stream number 3, which is over nootropics, because they said that it violates their Drug and Violence Act.
Oh, that is hilarious. Those are some great standards there, let me tell you.
Yeah, because like aniracetam is technically a drug. We told people they're nootropic drugs, but they said that I was promoting drug use on the show.
Oh yeah, really.
And so, it's just another way. It's, and then they're like, well, we're scared that because you guys are promoting drugs and violence, that our advertisers won't be able to market to a wide range of audiences. You've pigeonholed their demographics. And has
YouTube looked at the vast amount of stuff that's on YouTube? I mean, come on, really. I mean, it's just.
Whoa. I mean, it was because of the metadata.
I know. It's just boggles my mind.
Yeah, and a bot found it. But I mean, probably, and I haven't done any research on this or whatever, so somebody's probably going to call me out on this. That's fine. Because I'm learning too, but I bet that they have some sponsorships from pharmaceutical companies and they just don't want to compete. So this podcast will potentially get pulled too because of the Wellbutrin thing that we just posted.
Okay, well, I will say this for any pharmaceutical companies that are listening. Out of all the SSRIs or also the dopagenic agents as well, or norepinephrine, reuptake inhibitors, whatever classes, Wellbutrin tends to be one with a little bit less side effects than the rest of them. It doesn't get my recommendation.
Yeah, I would think that something with no active ingredients would have very little side effects at all. So good job on that, and way to design a product that's completely untestable. And way to go, pharmaceutical companies. You nailed it on that one.
Yeah, I mean, what are we going to talk about? We're going to bring up Vioxx and Celebrex now, which I actually saw an article recently again that they are claiming that these drugs are very safe again, and that people need them for their arthritic conditions instead of using curcumin. Come on.
Well, there is a threshold for safety, and like we were talking about with the nootropics podcast, there are some people that are willing to take more risks than others, and they're fine with that. And they said, we'll look at the percentages of people who are having trouble and are those disclosed and all this other stuff. But with the regulation that's going on with the FDA and how regulated it is, it's, people have their choices taken away from them. They don't have a choice. They can't just go and get whatever meds they want directly from the pharmacist. They have to have it prescribed, and it has to go through millions of dollars worth of testing, supposedly, through the FDA, and it has to go through all this rigmarole and policy and bureaucratic nonsense. So it goes through all this stuff, and so people assume that their drugs are safer than the natural package.
They'll shut down supplements in a drop of a hat. Not saying that supplements haven't had their problems either, because there's a lot of snake oil out there and a lot of supplements that are being poorly regulated and stuff like that, and made in China and so forth and so on. Not saying supplement companies are any better in somewhat regard, but still, nonetheless, they'll ban supplements without even thinking twice, and it'll take years to pull a bad drug off the market.
Yeah, it takes quite a while even for them to get supplements pulled. If you looked at the pro hormone ban during the George Bush administration. I think that started in 2005 when they started to ban pro hormones for athletes. So basically, these
Yeah, but
supplement.
there's a lot of money in that though in sports and stuff like that. When they,
Yeah.
you know, depending on where if there's money in it, the government's going to be less likely to pull it. You know, 1,3-dimethylamine that they were using in Oxy Elite Pro, it took them 3 or 4 years to pull it. Not that I recommend it; it's crap. But
Well, I mean, yeah.
you know.
I mean, a lot of people were, I mean, a lot of people were using it, and a lot of supplement companies were finding success. But some of the problem was, like, for andro, for instance, which is like I think it's a 3-dimethyl, and it basically you take this powder, whatever pill, mix it up, and you drink it, and then your liver converts it into testosterone. So it's basically like doing a steroid cycle, and so there's even post-cycle therapy that people would have to do afterwards, or else they'd suffer from a lot of side effects and muscle wasting and stuff. But anyway, the government just decided, okay, this is bad. Even though they've been around for a long time, they just decided one day, okay, people shouldn't have access to be able to control their sex hormone levels, and so we're going to put. They did an initial ban, and they named a bunch of different things that were now more. It was like Schedule 1. So this stuff was now in the same category as like what's another Schedule 1 drug? Like, let's just put it this way: cocaine is like a Schedule 3, I think. Yeah. So it's more illegal than cocaine.
Which cocaine does have its medicinal uses, though.
Well, that's why it's Schedule 3.
That's correct.
But anyway, so they said, okay, population, you don't have the right anymore to control your hormone levels in this way. So what we're going to do is we're going to take them all away. So they took away a lot of them, and then the supplement companies got smarter, and they're like, okay, all we got to do is change the methylation structure on this, and it's a new chemical, and then it's no longer illegal. And they put them out. And it wasn't until very recently where the government was like, okay, anything resembling a pro-hormone cannot be sold, with the exception of like DHEA and vitamin D. They put some exceptions on there.
Well, they banned hormones like DHEA in Europe, for example, or melatonin.
Yeah,
you can't get those in Britain.
In Australia. Yeah, that's true. But,
which is silly when stuff like proton pump inhibitors are on the market with all known side effects, and I can walk in any pharmacy and just pick it up and take it forever.
Yeah, but I think it's also like all the regulation, I don't think has been good. There's two, and we're getting a little bit into the political realm. Maybe I'm breaking my own rules, but there is a philosophy that people are dumb. They're too dumb to make their own choices. They're too dumb to educate themselves. And so we're going to make choices for people. And we're going to say, you can't do this, you can't do that, even though it's probably not harming anybody else. I mean, let's say you go and take a bogus supplement that is probably damaging and could even kill you. That's your fault. You took the supplement, should have researched more, or whatever. I don't know. Maybe it sounds a little cold, but then, or the other philosophy is, okay, people are smart. They've got the internet, they've got the power to search and educate themselves and figure out what's going on. They can make their own choices. And so they go out and make their own choices, and we just make this stuff available to everybody. But looking at our statistic of the American healthcare system, where 85% of the money going into it is going to administration costs, going to these regulatory bodies and these people that are perpetuating the system. I mean, what they're doing is, number one, they're keeping their job security, because they're like, okay, we need more regulation, we need more employees, we need more resources, we need more money. So they're building up their empire even more at our expense. So we're the ones paying for it.
Now, could I raise you that if they were doing the regulation that they're supposed to be doing, like, looking after, like, corporations that produce medicine in like India, for example, or, some of the Caribbean islands and stuff like that, make sure the factories are up to place and up to code and stuff like that, like regulation that is really truly needed. Instead of doing a whole bunch of other bureaucracy that may or may not be needed. I'm not as libertarian in my beliefs when it comes to that as you are. I think regulation is needed. I just think they do it incorrectly.
Well, I don't think, okay, so and then they could argue about the correct way to regulate stuff and go back and forth and then just spend more money on paperwork and bureaucracy and so forth. The thing is, in the process of regulating, the process of keeping us safe from ourselves, which we could argue whether or not they're even scratching the surface of that anyway. Where it turns out that, like, if you take painkillers, for instance, not over-the-counter painkillers, prescription painkillers, opiate class painkillers, are more addictive and have more side effects than like heroin that you would get on the street.
Yeah.
I'm not suggesting that you should go like, okay, I broke my femur bone. I'm not going to get my hydrocodone filled from CVS. I'm just going to go hit up the drug dealer and just, get some.
I mean, you're right. I mean, here's some OxyContin. Someone could teach you easily to mix it with a little bit of baking soda and a little bit of water in a syringe and melt it down and inject it like pure heroin. Here's a drug that is in some way more addictive than heroin itself. Or we can look at methadone, for example, opioid withdrawal isn't horrible as far as addictive potential and so forth and so on, as far as getting over that hurdle. Physically, it's going to hurt like crap, but it won't kill you as long as you're in decent shape, compared to like alcohol withdrawal, for example, which can cause seizures, delirium tremors, and so forth and so on. So, but methadone, as a way that they were using to get people off of these opioids, instead of using, heroin therapy, for example, which actually probably would have been a little bit safer than using methadone. Methadone can have withdrawal problems for up to a year, physical withdrawal problems. It's sad. We developed these medicines. We developed heroin to get off of morphine and methadone to get off of heroin, and each one gets progressively worse.
Yeah. So there's obviously a problem there, but again, that's I think a symptom of the greater problem, because if we didn't have so much regulation, then what would happen would be we could make our own choices and we could decide, oh, well, this actually is pretty dangerous. I would like to go a different route. And then that market shift would favor the superior products, the superior stuff.
But would that happen because corporations themselves, you would say that they have to, if we're talking about free market, for example, they would have to adjust and do what's right, or they would go out of business. But does that really happen?
Yeah.
I mean, the big corporations, I'm not talking about small corporations. I'm talking about large ones.
If they're not monopolies and if they're not too big to fail, then yeah.
No, I'm talking about Bayer. Bayer's a little bit too big to fail,
Well, I mean, we'll have to see. They've been around for a long time, and
they have. They put out a lot of crappy medicines too.
Yeah, well, we could go down the list here, but just to kind of depersonalize it from any specific companies or any specific things, we can just go back to ideology and think about, well, okay, so I was talking to somebody the other day, and they were like, man, wouldn't it be great if, XYZ tests that we could do, go down to Houston where they have a SpectraCell. A lot of athletes use that to get their blood work and figure out how much nutrients are in their blood and stuff. It's a pretty cool company. We're not affiliated with them or anything. I just think they're cool, and they're in my backyard over here in Houston.
Yeah, I've coached a lot of people who've got his testing done. I like SpectraCell myself too as well.
I think they're good, and people are like, well, my insurance doesn't cover this. This is terrible. Well, guess how much it would cost if your insurance would cover it. Oh man, my insurance company doesn't cover my supplements. Well, guess how much it would cost if they would be covered, and what kind of supplements could you get? The supplements that you like to buy, the choice of brands that you have, and if you use John's book, Fix Your Gut, which John wrote, what was it, 2 or 3 years ago?
It's been about 3 years ago now.
Yeah, and there was a lot of work. I still keep that book around as a reference, but good information about supplements and supplement brands, and saying, let's compare these brands and figure out what's the best and so forth. That becomes regulated. They're going to take your choice away of what's going to fit underneath that subscription, I wouldn't say prescription coverage, but your
So you
supplement
tell me
coverage.
there'd be more standard. You tell me there'd be more standardization in supplements where we'd only have a few brands that would be closely regulated. Which, okay, in that regard, yeah, it doesn't sound that great. But I still think that when it comes to supplements, I guess the best best protection you can have is buy from trusted companies, and the same thing I guess could be say if they did down regulation or deregulation of pharmaceuticals.
Yeah, I think that most companies that are not involved in sort of this monopoly type system, they're going to want to do their best for their customers. They're going to want to make a profit, but they're going to want to keep their customers healthy and safe so that they can continue to sell to them. If any of these supplement companies, something comes out and says, oh, they had lead contamination in their vitamin C capsules, that's going to really damage their brand, right? If Now Foods, this is just an example, this didn't happen, but let's just say hypothetically that Now Foods, there was something that came out that said that there was lead, like there was a large amount of lead in their vitamin C capsules or tablets. How much is that going to damage their brand?
But why isn't that exfoliated when it comes to like Tylenol, for example, where Tylenol has been found throughout, had many recalls since, God knows when, and people forget about them and so forth and so on. Of course, you and I, Jason, can debate acetaminophen and how it depletes glutathione and how bad it is for people for days and days and days. But pharmaceutical companies don't have to deal with this. You're right that, supplement companies do, but pharmaceutical companies are so big and so protective that even if deregulation happened now, they'd have so much money that they could fight through PR anything that anyone threw at them, right?
Well, how about this as an example? Go to a company that makes a generic prescription, any of them, and send them an email and taking your product over the name brand, whatever. I would like to see a certificate of authenticity, or COA for short. Please send it to me and see what they do.
But none of them would be able to do anything like that because that's not standard regulation. It's all FDA. And they would just send you a copy of the FDA report, which we already found out through Wellbutrin pretty much is BS.
But with my I can go and request a COA, and if I don't get an answer that I like, I don't buy it. I don't buy that supplement. And if I go to Smart Drugs for Thought and I said, hey, I want to see what kind of aniracetam you guys have, send me a COA, and it comes in and they show me exactly what's in there. This is 99.99% pure. No traces of lead, no traces of whatever.
Some people were saying that Consumer Lab, for example, supplement companies were paying them to give them better results, to say that these supplements looked better, like fish oil, for example. I'm not going to name any supplement companies. You can look in Google, search Consumer Lab fish oil controversy or whatsoever, saying that some fish oils looked more pure than others. In reality, they were not, and Consumer Lab got caught up in this.
I think it was krill oil, actually.
It might have been krill oil, yeah. I can't remember if it was fish or krill oil, but it was one of them.
It was krill oil, and and that's the great market confusion. They can do this and that, and there are supplement companies that come and go, and even a lot of these bodybuilding supplements where they actually circumvent the rules, and there are still companies out there selling pro hormones and so forth, and it takes them about 3 years to get busted and shut down. Especially if they're not domestic, if their headquarters aren't domestic, it takes them a long time. So I'm not saying it's a perfect industry, but the turnaround time for there's a problem and then getting a result is a lot faster than through FDA approved drugs. So by not having as much regulation, there's actually a superior result, I think, in quality control than there is to an industry that's under heavy scrutiny. And we're paying an awful lot of money, not only as taxpayers, but as private citizens. When we pay for our medicine, a lot of that goes into the paperwork, bureaucracy, insurance, that 85% factor that goes on when we buy it. We're like a very small percentage of our money is actually going to buy that drug. It's going for the bureaucracy. And my argument is that the bureaucracy is not keeping us any safer. It's not improving our quality of care.
I agree with you on that. I think it's too bloated. I think a standard system needs to be put in place for quality control and so forth and so on. But as you say, even if we went back to the bare basics, just like the USDA, for example, a friend of mine is a USDA inspector at a turkey plant. Most of the time, he's doing hardly anything at all, wasting taxpayer money. I mean, that's just how it is. You have to have, I believe you have to have small standard set rules in place, but eventually it turns into a beast that's uncontrollable. And that's how the cyclical part of government, like, I think you pretty much agree with me that speed limits should be in place, right?
Um, yeah, I think it'd be cool though if we could have, you could get like a special driver's license. Like if you can prove that you can drive faster than the speed limit and be safe, like I can go
but
20 miles over the speed limit and still be cool because, I just drive safer. But
but I will say, from speed limits, signs came seatbelt laws, which were argued to the American public that our car insurance rates would go down if we put seatbelt laws in, which never happened, and stuff like that. And then we talk about motorcycle helmet laws and so forth and so on. The regulation keeps getting stronger and stronger and stronger and stronger. So there has to be a fine line between basic regulations and what huge monster of bureaucracy.
well, the seat laws and helmets, they're reducing our healthcare costs and they're reducing our mortality rates. So there's kind of I mean, that's a piece of policy that's financially benefiting us instead of financially harming us. But here's the deal with insurance. Insurance went from a system where it was prepaid thing. So it's kind of like our one of those accounts.
The healthcare
that
accounts where you pay a certain amount of your paycheck every month and it saves to go to pay for your healthcare costs.
Yeah, they
Healthcare
used to
savings
call them
account.
like Benny cards. I think they call them. I don't know, but I've done it a lot, and you can prepay for your medical expenses, and it's tax sheltered,
Yeah.
so it doesn't you don't get taxed on that money, and then you just pay your medical expenses out of that
It's
account
healthcare
instead
savings
of
account.
right. And that's kind of how health insurance started to be until it started to incorporate and conglomerate. And now it's like it's not the same thing anymore. It's like you're going to pay this much a month, no matter what. If you get sick, if you don't get sick, if your house burns down, if it doesn't burn down, if you get in a wreck, if you don't get in a wreck, and we're gonna, our statistics guys are just gonna make money however they can, and our rates however we can. And so we said, okay, well, we protect the catastrophic stuff from happening. What if we have a catastrophic event? And that's kind of the fear they put in place to say, well, if we get away from health insurance to where it covers everything and blah blah blah, and it's kind of like we're getting something for nothing, and we just hope we get that winning lottery ticket, and like, oh well, if I get cancer, all my bills are covered. But the thing is, though, because of the paperwork and bureaucracy that's gone up, we're not saving any money at all by doing this. We're making it more expensive. We're making our healthcare costs increase. So we need to go back to a system where we prepay everything and everything is cash only. We're actually doing this for the birth of my next child in August, and we're paying cash for everything. And guess what? We're saving about $3,000 just by paying cash because we worked it out with the medical center there, and they don't have to file all the paperwork and do any of that stuff. And so it's saving them so much time and effort. They're not going to charge us as much. So I have to buy a healthcare insurance or else I get fined 1% of my income for each member of my household that's not insured. So I have health insurance. I don't ever use it because it's just cheaper for me to have health insurance than to not have it because of the fine that's been put in place. But I can be a cash patient and save more money than I could using my insurance company. And guess what? When I get the bill at the end, I'm not going to get any surprise charges where they're like, oh, we're not going to cover this or we're not going to cover that. Oh, what were you thinking? We're not going to cover, a vitamin K injection, all that crazy stuff that comes up at the end where, it's like they decide what they're going to pay for and what they're not going to pay for. And I guess, you could call them up in advance and be like, hey, what if this happens? What if this happens? What will you pay for that? But nobody ever does that. It's always after the fact. The service has already been rendered. And so you're like, well, okay, we got the raw end of the deal. And then they're like, oh, too bad. And there's nothing you can do about it. So I think my solution is we just need to go back to a cash society where we just pay cash for everything. And we support organizations like the Red Cross and the Salvation Army, people that help take care of the needy, and with the extra money that we save, we can help take care of the people that can't afford to do that. There's actually a new trend I guess it's not a new trend, but something that's happening now are like free free healthcare centers that are just coming out, not nonprofit, but totally free. They're just coming in, they'll treat anybody. And they're just set up to do that, and they have volunteer service and volunteer everything, and they just go through and people get treated.
Is it based on?
Yeah, and it's just something they're doing, and a lot of people are doing this, and they go out and they collect donations, and they're able to pay for their nurses.
They have one in Fayetteville called the Care Clinic, where based on your income, you can go see a doctor and get medication. Certain medications they have available for nothing, or dental care for nothing, as long as you can prove that you make less than a certain amount. They'll see you, they'll take care of you.
Well, even beyond that, there are organizations that do it for anybody, regardless of your income, and get treated for free. And there's no paperwork, there's no insurance, there's nothing. And they collect donations, and it's like, well, we don't have to pay for all this stuff. We don't have all this overhead, so we're just going to do it this way. And the indemnity that's associated with that is extremely low. I mean, there's not these lawsuit stuff that you're hearing about with other organizations. There's not customer dissatisfaction. I mean, it's kind of the way it used to be, and they're running it the way they want to. And I think it's extremely disruptive in a good way. And I think that's kind of where we need to end up being. If I'm not saying everything needs to be 100% free and you just go in and we need volunteer people but what I am saying is that cash patients everywhere is going to end up saving us a lot more money in the long run than it would to have insurance, which I think is getting to be a racket.
Yeah, I agree with you somewhat on that. I do believe that insurance is definitely a racket, and even subsidized healthcare through the government itself is also a racket too. Usually quality of life, as far as Medicare or Medicaid is concerned, if you're elderly or disabled, it's a lot harder to get services than, if you're healthy.
Yeah. So, yeah, and where you can go and all this other stuff, but that's the kind of thing that you have to buy into. You say, well, we, through my insurance or through Medicaid, Medicare, we only these hospitals will accept our coverage and all this other stuff. I mean, but what do you expect? You expect them to be completely universal, 100% insurance is going to work everywhere. All 1,200 private insurance companies are going to work in every medical facility. I mean, how in the world are they going to keep up with all that stuff? It's just not possible, even, with modern technology and more money to do it that way. So yeah, we have HMOs and all this other stuff to try to simplify it, and that cuts down on our paperwork. But what I'm saying is, instead of going in that direction, create more HMOs and so forth, what I think we should do is just go back to the 1929 model that the teachers in the Dallas-Fort Worth area use, and just either use prepaid services. So instead of paying, let's say my medical, I think my Medicare expenses for my private medical insurance for my family is like $1,200 a month. If I could just take that $1,200 a month and put it into an account, tax shelter would be great, and just keep it there. At the end of the year, I'd have a ton of money, in case somebody got sick or was in an accident or whatever. And if you get cancer, it's a one-time deal. How long,
Yeah, but all that Medicare, Medicaid money that are taken out of your check at the end of the month, the government needs that to balance the books.
Yeah, but it's not a significant amount.
Oh,
I
I
mean,
know.
if you
I'm just
look at
saying
our
it's.
defense
I mean,
budget,
you're right. You're right. I'm just saying they still need it to be able to balance, balance the coffers and everything like that. Compared to our defense budget, which is the largest in the world, it's a drop in a bucket.
well, okay, so $14,400 a year is what I'm spending on insurance. If I was allowed to just put that away or just use it as needed, let's say I didn't have any expenses come out. After 10 years, that's $144,000. That could provide some pretty good catastrophic care, right?
Yeah, I mean, for sure.
So I think that the math works out pretty well if we think about it. And the thing is, like, again, they come back and they say, well, people aren't disciplined enough to put that money away.
They're not.
They're not
Most people
disciplined.
aren't. No, they're not.
Well, and and that's unfortunate that we think population that people aren't smart enough to do this. And I guess if
I
we
mean,
could say, well, if you
for
could
some people,
prove,
it's hard because some people, living paycheck to paycheck, depending on how much they make and so forth and so on. If you're only making minimum wage, you're not gonna be able to put much. And I understand if the system was perfect, then you'd have charities that would pick up the slack and so forth and so on, and stuff like that, instead of the government having to do it currently, and or taxes having to pick up the slack. Um, but for some people, it would be difficult.
um, yeah, actually, I was talking to my employer a while ago, and I said, if I made $200 less a month, I could net $1,000 more a month in benefits, and subsidized benefits. But yeah, we have social programs that give free health care, and we've had this since LBJ, Lyndon B. Johnson, that we've taken care of the bottom 15%.
And I mean, even if it's a catastrophic emergency, a hospital by law has to treat you. They have to at least medically stable, get you medically stable. They can't just, let you die or, drop you out in the street, even though there have been cases where they have dropped some homeless people out in the street, let them die out in the street, sadly.
Yeah. To do, obviously, yeah, but at the same time, we don't want people stiff in hospitals. So that's not a good situation. We need to have some kind of a way to pay the hospitals for their services rendered. If charities could kick in or whatever, we could have some of those free clinics, and not free clinic, you know what I mean? But like actually free healthcare centers. I'll have to look up the correct terminology for those.
I don't know, Jason. The hospital where I live at Kidford Valley, they are so understaffed, and it's such a small hospital for the amount of population that's in Fayetteville and stuff like that. And a lot of people complain that the CEO for the hospital makes way too much money.
Well, yeah, I mean, that's a for-profit deal then. But I mean, if you look at let's just call it the Patch Adams system, where people go, I mean, oh, shoot, YouTube's going to shut us down. Sorry, YouTube. But anyway, yeah, they've got and they get the quality care that they want, and they don't pay anything for it. And doctor that was based on a true story, and doctors were coming in from everywhere to go and work, and they got tons of donations and everything. But in any case, for reasons mentioned, YouTube they took down the ads from our stuff so that make sure we won't ever make even a penny of advertising revenue, but that's okay. I would be fine if our show would just operate kind of on that principle too. If you like the show, just donate $1 or something. Go to the fixyourgut.com, donate $1 or whatever, and we'll stay going. There's some cool stuff that we're wanting to do. We're getting some new equipment coming in so that we can have a better live stream with the Twitch service, so we can have a live chat going on, be more interactive. You can get your information faster. To our YouTube subscribers, we appreciate you guys subscribing, and we give all of our YouTube subscribers we do a drawing every month, and we give them a box of Unfair Advantage. We had our first winner last week, and after this podcast, we're gonna basically, I just look at the total number of subscribers we have, and I get a random number generator, and we just generate a random number, and I count up, and that's who we end up mailing it to. So if you're registered through YouTube, you're automatically registered to win, and we appreciate you registering. John, you got anything to add before we sign off?
we're going to do another question and answer on Monday. I'm sorry about this past Monday, but that's when my grandpa broke his femur, was in surgery. We are. So please send your questions to either fixyourgut.com, post in the comments threads for the live streams, or the forum, bulletproof forum thread for Fix Your Gut live stream. Post your questions there for the Q&A. Next Q&A is going to be really good. A lot of gut questions. A lot of people sent in. Me and Jason are probably going to argue over a few of them. So, of course, one thing I do want us to argue eventually on is vitamin C, because we all know Jason over there could be a curmudgeon when it comes to vitamin C. So I can't wait to get in a debate with that one.
Yeah. So anyway, thanks for listening. And again, we appreciate your donations. We've got a lot of donations in.
Thank you, everyone. Yes.
Yeah. If you're somebody who's been donating, I know we're saying donate, but we're just trying to gently remind people to do that instead of trying to sell things to you that you may not want. We could get sponsorships through various companies. But it's kind of like when the Girl Scouts come to my door. I don't eat cookies. All right. And so whenever they come to my door, I'm like, can I just give you money? I don't really want cookies. And they just look at me weird. So we're not going to try to sell you stuff that you don't want and that you probably don't need. So
the Samoas are so good, though.
Yeah. If you'd like to donate, that would be awesome. And thanks again for everybody who's donated. Thanks. If you're listening, if you're not in a position right now to donate, we still appreciate you too. And again, if you subscribe, you'll be able to try and win some unfair advantage. So thanks a lot, everybody, and we'll see you on the Q&A next Monday. Bye-bye.